Hi, everyone. I'm Julie Flakstad, and welcome to the Midlife Truth Project, a special 9-part series aimed at better understanding the myriad of transitions and change that we as women face as we settle into our 40s and 50s. Today, we're talking about sex and intimacy, which, to be honest, is one of the most vulnerable topics that I've had with all of the interviews with women across the country. There are a few reasons for this. One of them is the fact that many women just don't feel like sex is their story to share anymore, especially if they've been in a long-standing relationship with a partner or a spouse. So I have to say that Dr. Taz and I are incredibly thrilled to welcome Dr. Kelly Casperson as our conversation partner for episode 6 of, again, this special 9-part Midlife Truth Project series. Dr. Casperson is, as many of you may know, a celebrated urologist based in Seattle, Washington, where she lives with her family. And she is also creating truly like a movement around adult sex education with her award-winning podcast, which is called You Are Not Broken, as well as her TED Talk, which you absolutely should listen to. It's 12 minutes. It's incredible. And also her best-selling book under the same name, You Are Not Broken. And P.S. to that, this book was just re-released, so if you haven't already read it, you should definitely order it. And lastly, if you are like me, someone who wants really hands-on learning, then you should consider her online masterclass, where she actually provides personal coaching as well. So let's do this. Let's welcome Dr. Kelly Casperson, and let's talk truth.
The most common signs of an aging neck are the development of vertical muscle bands, sagging skin, and excess fat deposit. It is important to pamper the area often neglected, the thinning, crepey skin of your neck and sort of this whole décolleté area, using a hydrating and smoothing solution that goes on with a cooling and massaging roller applicator. Women-S is the leading women's wellness brand that is modernizing aging through clean products formulated to meet the needs of your changing skin, hair, and body. They created the Let's Neck and the Décolleté Serum, shown to help instantly tighten and smooth. It helps firm and brighten over time with less sagging and crepiness. Their medical-grade stainless steel roller applicator cools and massages the skin and is formulated with unique plant-based ingredients. Women-S is available nationwide at Ulta Beauty, Amazon, and on womenS.com. Get 20% off orders of $50 or more by heading to womenS.com/midlife and use the code midlife20 at checkout. Women-S, live fully and age well.
Well, hello, everyone. Excited that you're all here. Yay.
This is going to be fun.
This is going to be great. Kelly, first of all, Dr. Casperson, is it okay if I call you Kelly?
Yeah.
For everyone listening to this, I've had the pleasure of getting to know Dr. Casperson. I don't know, maybe 3 years ago was the first time I met you. And hopefully I'm not going to creep you out with this story, Kelly, but you were, if I recall correctly, you were at the first, the New Pause event. It was in Soho. You were sitting in the back. And again, hopefully I don't think that I'm a stalker, but there you were sitting in the back, you had your funky short hair and you were wearing this black leather kind of motorcycle jacket. And I totally thought, I was like, this woman is definitely with Rolling Stone or something. She's covering this for the media.
Cool chick.
100%. And it was an all day event. We were all buzzing around. And then fast forward, I saw you at the next event, which was, I think another menopause event in New York. And then all of a sudden we were in South by and I saw you there. But then poof, somehow within 12 months, you were center stage and you were on every stage for every event that I went to from there on in. Thank you for being here. So I've teed up everything in the intro. So I'm just going to kick us off with the first question, which is, really the title of this episode, which is, why is sex complicated or so complicated at this stage in our lives?
It is. And I never mean for it to be complicated, like you can't deal with it. Like you can certainly deal with it. But I think part of the reason why it is complicated is because we got no training, right? If you were lucky, and we know sex ed in America is worse now than it was in the 90s. So if you were lucky a couple of decades ago, you got a disease and pregnancy prevention plan. Probably when you weren't married, probably when you weren't sexually active. And certainly nowhere in there was there information on, we didn't get consent information back then. Nobody learned about the clitoris, right? If I think back to my sex ed, I remember a picture of the ovaries, fallopian tubes, and uterus. And that's it. Like that, they don't really play a part in sexual activity except for the pregnancy part. And so we got that education. Fast forward a couple of decades, you're in a long-term committed relationship, or maybe you're not. You're an adult. You're trying to navigate something that you got no education in, except for we got crappy education with like Hollywood, right? So we get all these myths of sexuality thrown down our throat, like you should have spontaneous desire all the time. You should have a spontaneous, at the same time orgasm within 10 seconds. It should never be messy. You should never fart. Your penises should never go soft. Like all of these things that Hollywood, that's our sex ed, because we're just trying to get it wherever we can get it, and media portrays, it's fiction, basically. So it's a complicated topic we got no education on, and then where we're trying to learn it from is not accurate.
So how do I know one of the things I love that you always lead with is that let's stop talking about sex as penetration. You always lead with it's sex and intimacy. So help us understand like why that reframing is so important.
It takes it away from it being a performance, right? Because people are like, they get all what's called spectatory. Am I doing this right? Is this taking too long? Is this not going fast enough? What are my thighs doing? We get all spectatory and like how it's supposed to go, especially in the heterosexual normative view of a linear event. This is how it starts. This is how it goes. This is how it ends. And if you step off of that path, you feel very broken. But sex, a nice way to think about it is like, what do you actually want to get out of it? How do you want to feel? Right? And then you can kind of retroactive be like, oh, I want to feel loved. I want to feel connected. I like to feel warm. I don't like being cold. Right? So it's like simple things of how do you want to feel during it instead of that you think it needs to go via a prescription in a linear way.
And I just want to add for those listening, from the conversations that I've had with, all of these women through the Midlife Truth Project, is one of the things that I've walked away with and in the complexity and and sex being complicated is that there's such a vast spectrum of how women are being sexual. Like on the one hand, you have women who are not having sex at all. And then on the other hand, have women who are having the best sex of their lives, right? And then you've got this enormous middle of people who are either just going along for the ride, or people who kind of, that wanted, like me, that want to get better, that want to lean into their sexuality, but don't know how, right? And so that makes it complicated. And the other thing I've heard is that there is so much shame associated with sex. And so we're not talking about it. And so we feel, as you love to say, broken, or we have, shame, we feel alone, we feel judged. And that is that's a heaviness that sits with us. So that's just another aspect of it being complicated that I want to just lean into in the conversation.
Sex is biopsychosocial. And I hated that word. That word sounded super complicated. Nobody knows what biopsychosocial means. It sounds very academic to me. And as I was writing the TEDx talk, they're very linear talks. Like, what's the problem? These are the three things. Well, like TED Talks all go along like, these are the three things you should know. And I'm like, gosh darn it, sex is biopsychosocial. Like it's perfect for a TED Talk. And so we're biology. Our hormones are changing. Our bodies are changing. We might need a hip replacement in midlife, whatever is going on. We've got body image issues. So biology, and then psychology, that's the body image issues. What you've been taught about sex, your relationship, how skilled are you at communicating about difficult things with your partner? Are you guys avoidant? Right? Sex is going to be no different. And then social and the sociology is the religion, the family you grew up in, Hollywood's portrayal of what a woman can do sexually, right? In our society, right? Like, what do we call a woman who likes sex? It's a bad name. So a lot of us are raised to be like, no, we don't want to desire too much. Those women are called a bad name. And then we get to our midlife and we're like, I wonder why I don't want sex. Right. And it's like the biopsychosocial, all of it influences our sex life.
It's also such a time, I think, where relationships are changing, right? Like you might not be with your original partner, you may be with somebody new, and then there's that whole angst in trying to relearn some, basically relearning your skills in the context of being with somebody brand new,
Yeah, I mean, when you have partnered sex, there's two people involved, sometimes more. No judgments here, but you navigating everybody's wants and desires.
Yeah.
Right. Instead, because it's a stereotype, but in a lot of heterosexual relationships, the woman just kind of goes along. Right. What does he want? What gets him off? Sex ends when he comes. Right. Instead of being like, what do I want? What do I want sexually as something that's completely separate than what my partner wants? And knowing it's okay to have two separate people who come together to do this. Instead of just saying, I've always just kind of like said okay when they desired sex. Maybe I've never allowed myself to desire because I've always been responding to other people's desire.
Do you feel like, I'm so curious, do you feel like women desire sex or do they desire intimacy? And sex is the natural outcome? Or can we, I feel like men can separate sex and intimacy. Is that fair to say? I feel like a lot of men, have you seen that women can do that too?
Yeah, I mean, stereotypically, they'll say men use sex for connection. Women want to be connected in order to have sex. That is your stereotype. Men are from Mars, women are from Venus. But it is a broad brush to say all women this, all men this, blah, 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 right? And I think it really limits the wonderful diversity and complexity of all humans. Not all men have high sexual desires. Not all women have low sexual desires.
And I'm going to chime in there because one of the things that makes me so irritated is this narrative that like men are always horny and that we as women have to fend them off. Like, because if you're in a situation where it's the opposite, where that your partner isn't necessarily making that first move or hasn't in a while, then again, back to your famous words, you feel broken. You're like, why doesn't he want me? Or she, like, why doesn't she want me? I feel like that is such a myth that like he always wants sex. They're programmed to always want sex and you're just on the receiving end and you decide if you want to or you don't. Like there is something to be said for women who want to have sex and owning that.
Yeah. Oh yeah. And you can just see the role of like, think of the top 10 country hits, right? That is spontaneous desire 101. And same with Hollywood. And so like men feel broken too, right? Like their bodies are held to a standard of they always need to be ready on a dime. Penises should always be erect for as long as they want them to. They should always have more desire than their partner. Like they should always be the pursuer, right? So men also have these stereotypes that is a lot of pressure on them also. So nobody's getting out unscathed in this, sex ed thing. But that's why I love adult sex ed is because you get to communicate with adults who are intelligent people about a complex topic. And once you start talking about it, everybody wants to share their story, right? And one of my favorite quotes is like, nobody's so good at sex that you can't get better.
I love that.
Like, who's the person who's like, I'm good? They're pretty rare.
Right. Well, one of the things I've noticed, in our exam rooms when I see patients is exactly that. It's not just a female story. You have a lot of men whose libidos are going down or who just don't have the energy, who are falling asleep on the couch, who are snoring. I had a patient the other day saying like, can I send my husband to you? He's turning into like a grumpy old man, who just sort of snores and he's out. And I'm sitting there going like, okay, I guess not tonight. I guess not the next night. I guess not the night after, so what's happening when we think about sex and sex ed in this phase of life, right? Sort of this perimenopause, menopausal phase as a couple, as a relationship, what's sort of happening overall when it comes to just the biology of sex, right? You said biopsychosocial. Where's the biology shifting that maybe you have a perfect relationship and you are super healthy, but all of a sudden the lights have gone out? So tell us a little bit about what's happening. And I would say with both, because I know Julie and I have some interesting stories and we're on a little bit of a different side of the spectrum. But I think for so many women, it's not just about you, the woman, it's also about the partner, male or female, and where they're landing in this conversation.
I mean, I think the grace we all can give ourselves is what we think sex is not this, your body's not always 18, right? Your body's not always 20. And this grace of like, we do change, we do have health issues, our partners have health issues, and figuring out, that's why I say, talk about sex with your partner when things are going well. Like get a baseline of
Ooh,
we can
that's a
talk
good
about
one.
what's going well. Because inevitably there will be not well things going on, whether it's kids at home or ailing parents or a hip replacement or hormone changes, right? Like it will get bumpy, guaranteed. So if you can talk about it when it's good, you've already had a sex conversation. So you can then be like, hey, let's talk about this again. How's it going for you right now? But I would say hormones, erections, genital urinary syndrome of menopause. It happens to almost everybody. Nobody knows about it, right? Like those things happen. I see so many women, they stopped being sexually active 8 years ago. In my experience and what the sex therapist will say, it's a heck of a lot easier to resume sexual activity when you haven't given yourself a year's gap.
That long, yeah.
It's doable. I don't want to
Goodness.
tell anybody it's not doable, but now you've got like apprehension and concern and, maybe some more issues than if it's just been a couple of months. So just something to think about. Well, there's an amazing sex therapist, Barry McCarthy. And his opinion in one of his books is like, if it's been like a couple of months, like deal with it, because the longer it's been, it's just more awkward. It's like, I haven't run a marathon in like a decade. And like, I can still run a marathon, but there's a couple more hurdles I gotta, there's a couple more hurdles I gotta get to than somebody who ran a marathon like 4 months ago.
And I think you had a stat. It was something I was listening to a podcast that you were being interviewed for. And it was a stat, which was staggering to me, that if you are in an asexual relationship, you had sex less than, what's the stat again? Like something like,
what did they call? They were saying that asexual is less than 10 times a year.
Oh, wow.
Yeah, say that again. An asexual relationship is considered to having sex less than 10 times a year. That was, I think that's staggering what it was to me. And it really, like, it was like a knife to the gut, because I was like, I have to take more control over my sex life because I don't want to be in that category.
Yeah, but I mean, I hate numbers, and this is exactly why I hate numbers.
I was about to ask you about numbers.
Like you were doing fine until you compared yourself to somebody else's sex life, right?
Thank you.
Like,
say that again.
Knock it off.
Yeah.
Like, and that's why people ask me all the time, they're like, what's normal? What's normal? What's normal? And I'm like, normal is what's healthy for your relationship. Normal is what you two, or you, depending on how many people are partnered, is good for your relationship. Because otherwise it becomes like 8 fruits and vegetables a day and 30 minutes of cardiovascular exercise and sex every 48 to 56 hours. Like it becomes a prescription, and sex is play. Sex is play.
Ooh,
it's
that's
playful.
Important.
Like if you make it a job, don't wonder why you don't desire this activity.
Writing that down. Sex is play.
That's so important. That's so important. But
this is not a job.
That's a question I get asked all the time. Like, what's normal? When do you know? Well, is there, maybe not normal is the question, but this is straight out of, my patient's mouth. What are the red flags when, you're not having sex maybe as often as the other partner wants to, or something like that? What are sort of the guardrails? How do you navigate that?
Well, so that you bring up a really good point, which is desire mismatch, right? And so that's incredibly common. I would say all relationships have desire mismatch. You like pizza more than they do. They like breakfast. You like brunch, right? Like you desire things differently. We can all agree to that. You like pickleball more. They like watching football more, whatever. So like you have desire mismatch for everything in your life. Let's normalize that sex is no different. Right? It's like this, like we make sex to be this big deal that we don't agree on. It's like, well, you're not matched. You like Toyotas, they like Hondas more, right? Like you're not matched on anything, rarely. And so then you can be like, oh, okay, so this is just another thing that we've got to navigate. Like how many times a week do you want pizza? So the question to ask is what does sex mean to you? What do you get out of sex? I tell you, people live in the same house for decades and they don't know the answer to that for the other person.
We have to ask these questions. I have women coming in being like, well, I'm along for the ride. I think, Julie, those are your words. I'm along for the ride because in their heads, they're like, if I don't go along with this, then I'm at greater risk for getting divorced or for, other partner cheating on me, that type of thing, and finding something outside of the relationship. But I don't think that's a healthy construct either,
I agree. I think a lot of people are kind of, I don't say stuck, but they're kind of in this mediocre type of living where it's kind of a coercive situation. A lot of people will be like, well, I have to have sex because otherwise they're going to get grumpy. And it's like, you doing something to control somebody else's mood or attitude, like, look at that. That is
terrible.
Worth looking at.
Yeah.
And the reason I'm so frustrated about this is the research on this is minimal. And you hear it in your clinic. I hear it in my clinic. This happens all the time. And people don't know that there's a different way to live. Right? But your partner wants intimacy. Understand why. What are they getting out of that? That's how they feel loved. That's how they know you love them. That's how they know that they're yours and not somebody else's. Right? There are deep meanings to sexual activity that aren't just physical. And understanding that can go a long way. And instead of it just, because it's dismissive of your partner too, to say, he just needs blah, blah, blah. Did you ask him why? Do you ask, like, what does he get out of it? And that understanding allows so much more compassion. Like, oh my God, I had no idea that's how he felt love.
I think that's a problem, or it's a challenge, I should say. Not unsurmountable, but it's a challenge, because if you have been in a relationship where you don't necessarily have the communication tools to be talking about, I want sex and intimacy because that is how I feel loved. That's how I feel seen. That's how I feel validated. Being able to say that out loud is really hard for a lot of women.
Of course it's hard. Julie, this is midlife. This is when we get to do the hard things because we want to grow.
So how do we, yes, tell us, like, if you're not used to having that conversation, how do you plump out with that one?
Don't do it while you're naked.
Thank you.
Don't do it while you just failed to navigate a sexual situation. Don't do it when you're pissed. My best advice is do it while you're walking. Go on a walk. Walking is incredibly safe. Scanning the horizon with our eyes is of safety to the brain. And you don't have to look at the person, right? So you're clothed, you're on a walk, and you're like, I was listening to this podcast about like sex in midlife, and they brought up this really interesting question. What does sex mean to you? Now you have to be willing for your partner to not answer that, right? You have to be a good listener. And then you're like, oh, because them not answering it or them being awkward with it is telling you, oh, they're uncomfortable with this topic too. Like, just being a good listener can engender some compassion for the other person.
That is brilliant. I love that.
So can we rewind for 1 second just on the biology part?
Yeah,
because I want people to understand this. What is physically happening? I know kind of the answer because I'm all over the vaginal estrogen, but can you talk to us about what physically is happening with our bodies and what we need to do to...
And then to piggyback on that too, Kelly, like you mentioned the genital urinary component of that. I think that's really important. I think the word hormone is getting thrown out a lot, and hormone imbalances, and everyone needs estrogen. I think everyone's got that. But like the specifics, of what is happening here, I think that's the part that people are getting really confused about.
So it's called genital urinary syndrome of menopause, GSM for short. And you have to step back enough for people to understand that estrogen and testosterone in all bodies work everywhere in all bodies. Because if people just think, oh, it's a hot flash and my periods are done, they will have nowhere in their brain will they connect what's happening in their pelvis to the hormone changes that happen. GSM can happen during perimenopause, so you can still be having cycles. And it might not happen until 5 years after you're done with periods. So it's not going to happen like right when your periods end in a perfect age 51. Here it is for everybody. Happens in 50 to 80% of women. Some people think higher. It's underreported because who wants to go to their doctor and talk about this stuff? But it's the constellation of symptoms that happen in the pelvis because of low estrogen and sometimes testosterone. So that's bladder leakage, urinary frequency, more urinary tract infections, burning when you pee. Your labia minora and your clitoris can atrophy. Labia minora can actually go away, which are both sexual and protective structures. Tightening of the vagina, decreased elasticity, decreased lubrication, decreased ability to orgasm, decreased ability to have arousal. Pain with penetration, especially at that 6 o'clock. I always use that area between my thumb and my index finger to be like, that part of the entrance of the vagina gets very thinned and irritated. That's a notorious pain spot for people who have penetrative intercourse. vaginal estrogen is cheap. It's like the only thing that's actually getting cheaper in this day and age in America is vaginal estrogen. Like, it's fascinating to watch. You could get Mark Cuban Cost Plus Drugs, for example, just because they offer generics at very low prices. I have no financial relationship. $13 plus $7 shipping. Like, do not spend a ton of money on your vaginal estrogen. It is a lifetime drug, because if you stop taking vaginal estrogen, your tissues will go back to their low estrogen state.
No, that was great. But you mentioned testosterone, and I get a ton of questions about that. Like, is there a place for vaginal testosterone, vaginal progesterone? What are your thoughts about some of those other ones?
I have not seen much research on progesterone in the pelvis. For the sex med people, we don't really address progesterone as far as it helping in any way that estrogen or testosterone doesn't. Testosterone locally, so that would be a compounded product because there's no commercially available, can help with arousal. Also, if you're experiencing atrophy, provoked vestibulodynia, which is a medical term for pain when the vestibule is touched, that's another application for compounded testosterone. By and large, it's systemic testosterone that really gets the bill for sexual desire, but so not local. So the majority of testosterone would be a systemic testosterone, unless you have a specific vulvar need where you really want to push in those androgens.
And this is a source of confusion because, I live in a suburban town and and for the people who are on hormone therapy, they're like, oh yeah, no, I'm fine. I'm taking estrogen. I'm like, yeah, but are you taking vaginal estrogen? And they're like, no, I'm fine. I'm on the whatever. Can you explain to people why it is important to be considering both vaginal estrogen as well as estrogen as hormone therapy?
Yeah. So systemic hormones, when you take them in a patch pill, whatever you're doing for your hormone therapy, is still very, very low dose hormones. And I always say that the pelvis is the last stop on the train, right? So like you take that systemic estrogen, it's going to your brain, it's going to your bones, it's going to your heart, it's going everywhere else. There's just not enough to often get to the pelvis, is how I think of it. So some women are fine. They're like, I'm doing great. I don't need additional vaginal estrogen. But about 30 to 50% will need both because the systemic estrogen they're taking is still so low. And it's perfectly safe. Don't let a pharmacist tell you that you can't be on both. You can be on both.
Let's be honest, midlife comes with some seriously unexpected changes to your sex life, like loss of libido and, yep, you guessed it, vaginal dryness. I know, it's a lot. But you're not alone. And thanks to Womaness, the leading women's wellness brand, you can tap into all their education, inspiration, and clean products that are exactly what your changing body needs. So let's talk about what we do need. Vibrators, for one. And good news, Womaness teamed up with Love Honey to create a powerful rechargeable vibrator that has like 7 vibration modes and a removable silicone sleeve. And who knew there's skincare for down there too? Womaness has 2 different vaginal moisturizers. I know because I've tried them. So check it out at womaness.com/midlife and get 20% off all orders of $50 or more by using the code midlife20. That's midlife20 at checkout. Womaness, live fully, age well.
So while we're talking biology, what's happening with our men? Let's talk about them as well, assuming you're in a heterosexual relationship, because I think this is really important. And, I can attest to some of this, but tell us what's happening there.
So their big change is blood flow to the penis. Erectile dysfunction is common, meaning experts will say 40% by age 40, not complete erectile dysfunction, but issues with the penis being erect. The other thing to know is like the penis is allowed to get hard and go soft and do it. Like it doesn't perform 100% all the time, and that's normal. But if it becomes like a persistent thing where you're struggling to get an erection adequate or satisfying enough for sexual activity, see somebody about it. It can actually be a sign of heart disease. Erectile dysfunction can preclude a heart attack by several years in a good chunk of men. I actually had one woman message me and she was like, because I heard that you said the link to erectile dysfunction and heart disease, like her husband started having erectile dysfunction. She brought him in. And he ended up getting a big workup and treatment. And she's like, I think you saved his life.
And this is something like I see over and over again as men develop more metabolic syndrome, right? And they end up on blood pressure medications and cholesterol medications, and maybe they've had their first heart attack or whatever it is. it impacts them in the bedroom, right?
100%.
And then maybe they're anxious or depressed, so they go on anxiety or depression medication, which further impacts them in the bedroom. So men are just as like wound up in this, as women are. And speaking of medications, I guess that leads me to my other one. And then Julie, I promise I'll shut up for a second.
God,
But anyhow, but speaking of medications, what about all the women that go on anxiety and depression medications? That's like a first line treatment for women, even sometimes before hormone replacement therapy. I feel like that has some sort of impact on all of this. And then my follow-up question to that were the new medications like Addyi and some of these things that are out. I'm curious, like, what's your opinion of those?
Yeah, so antidepressants are notorious. Like, how I would love a study to be like, how many people who are put on antidepressants were actually told sexual dysfunction was an issue? I think that it certainly gets dismissed, but can be very upsetting to relationships. About 80% of people who are on antidepressants will likely have some sort of sexual dysfunction because of these medications. It's pretty pronounced. And you bring up another good point of, are we treating midlife, perimenopause, menopause symptoms with antidepressants instead of hormones? Yes, we are. We know we are. We saw what happened to the rates of those prescriptions after the Women's Health Initiative and people got taken off their hormones. So that'd be my first thing to think of is like, truly, do you need to be on these medications, or is there something else you can be doing? 25% of women who are 60 are on these medications, besides the fact that they are associated with fracture, which nobody's told about.
We're not talking about that.
No, we're not talking about it at all. It's because it works on the serotonin receptors, and then we have serotonin receptors in our bones. It's fascinating data. There's actually meta-analyses on it. And I'm not here to rip people off their meds. I'm here to say all medications have side effects. And can you get a comprehensive analysis to say, do I actually need this medication, or can I try something else, is what I would say. Addyi is flubanserin is the generic, and then Vyleesi is bremelanotide. That's the generic and brand name. Those are the two FDA-approved medications for hypoactive sexual desire disorder in women. The thing to know about hypoactive sexual desire disorder, this is where like it is mushed broccoli. You had a great sex life. Your relationship is great. You understand the biopsychosocial, and you just really don't want sex. It is like a gray, mushy oatmeal. Like, but you used to, right? And so you're like, I know what that feels like. I've got this great relationship. For those women, it can be a neurotransmitter problem in the brain, just like some depression can be for people. And how these medications work is they increase dopamine in the brain. And for the people that this medication works for, it works great. Now, this medication won't fix your relationship problems. It won't fix the fact that you don't know where the clitoris is. Like, it won't fix the fact that you prioritize your partner's orgasm over your own. So I think we need to be clear and be like, these aren't miracle pills, but for people who have the low neurotransmitter in the brain, that when they increase that again, oh, this thing I found pleasurable is pleasurable again. It's a wonderful option.
So one just tiny thing that has been recommended to me, and I'd love for people to understand the difference. You can take vaginal estrogen, again, which is highly effective to reduce pain. And I'm not a doctor, but, help the sexual experience. But there's also things like Bonafide and these different creams. Talk to us about the difference between vaginal estrogen and things like Bonafide.
Yeah. So there's vaginal moisturizers, and then there's sexual lubricants, right, which we can also talk about. But so these are vaginal moisturizers, usually have a hyaluronic acid component to them, very moisturizing. They hold in moisture. They're lovely. They're soothing. They're safe. They're not going to hurt you. Vaginal estrogen actually fixes the reason why it's happening in the first place. Right. So I kind of think of it as like fixing the reason why it's happening in the first place versus comfortable Band-Aid. They're both useful. You could use them both at the same time, and it's all on the table as far as I'm concerned.
And in my opinion, they're life-changing.
But I mean, the thing for people to know, for like the people who are like, I don't want any sort of hormone, blah, blah, blah. First of all, vaginal estrogen is literally skincare. I call it skincare for down there. It's so low dose. There are very few people who can't take that medication. If your physician has told you you can't, I'd question it and really understand why, because there's very few people who can't. And genitourinary syndrome of menopause, unlike hot flashes, which tend to get better over time, genitourinary syndrome of menopause will get worse over time.
Yes. And I just want to say that my doctor when I was 46 years old. And I went in and I would get a UTI literally every 6 weeks. At one point, I was like holding a bag of like ice cubes on my privates. It was so bad. He told me that you have honeymoon syndrome. He said, you're just not having enough sex.
Oh my God.
That's why you're getting the UTI.
I hate that. I also hate women have been told that sex will cure their GSM. Friction on your skin does not cure a hormone problem.
Yeah,
God
no,
bless.
it's so unfair. And I just want to like give a shout out to our sponsor who I adore, Woman S. Let's talk about all of these different types of moisturizers, vaginal moisturizers, and lubricants, and the role that they play as like a third tier.
Well, moisture, I mean, it's comfort, right? So I would see somebody who's trained who can give you a prescription. In America, vaginal estrogen is a prescription. In the UK, it's over the counter. You have to be 50, but it's over the counter. And so make sure there isn't other things going on. There's always other skin conditions that can be happening. Lichen sclerosis is a common one. But once you've got that, everything checks out. It looks good. I'm on my hormones. Moisturizers are great. They're comfortable, right? So I have no problem with them, except for people who think that it's going to fix what it can't fix, right? They can't fix a hormone problem. They can make your skin more comfortable as it progresses and gets worse. But yeah, they're over the counter. They're cheap. Everybody's got their favorite one.
Or find them. So before we like step into like the last part of the conversation, which is kind of like I consider like a speed round of all the questions I've heard over the last, I think for a few years, I just would love your quick responses to. But you talk a lot about, mindset, like that our brain is our biggest sex organ. And I want to understand that better.
I mean, I got into it. I actually got a coaching certification because of sex. Because I got to the point where I'm like, I can make your pelvis perfect, right? I can send you to the physical therapist so you don't have tight muscles. I can give you Viagra so your penis works. I could give you vaginal estrogen so you're lubricated. I can tell you the best lube and vibrators to get. But if you think sex is a chore, or you think sex is dirty, or you think it takes too long, or you've got body image issues, or you think your partner needs to X, Y, and Z, your perfect pelvis isn't going to get you a good sex life. Right? It's really how you think about sex. And I think even just the simple reframing of like, this is supposed to be fun, people. Like, this is supposed to be play. Is like, oh, I have been taking this way too seriously. Right? It's okay that it doesn't go perfect all the time. It's okay that body parts sometimes just don't want to cooperate. Like, it's okay. It's okay to try and fail. And there's this lightness that comes with reframing sex instead of like, I need to do it 3 times a week and it has to go this way. It's like, lighten up, people. No. And certainly stop comparing yourself. Somebody was saying if anybody in a party situation says they have a good sex life, they're either unicorns or liars.
So Kelly, and before Julie jumps into her rapid fire, which I can't wait for, if we had to leave people with sort of like not a recipe, but like a mini treatment plan, like start here. If you have concerns about your sex life or you're not feeling fulfilled sexually, what's the first thing they should do? Where do they go next? Where in the order sort of is hormones, mindset, lube?
Yeah, it's more like a grab bag instead of like a linear experience. Like first you get the lube. It's not for everybody, right?
Right.
I mean, I wrote my book because in a 15-minute doctor appointment, you can't undo 3 decades of societal shame, crappy relationships, body image, where's the clitoris, right? So it's like a level of education has to be obtained before you're like, oh, I can start working on this, right? So it's education, books, podcasts. That's why I created my book and my podcast, because then you can learn it at your own speed. You can share it with your partner if you want to, right? Start learning, because I think to say, oh, you just need to see a doctor or you just need to see a sex therapist. Number one, there's just not that many around. But number 2, I don't think people need that level of professional help for the most part. So many people are like, oh my God, I talked to my partner. We tried a new lube and we focused on my orgasm. It turns out I love sex. And it's like, sometimes it is kind of easy. You just need a little bit of education.
I like that. That's really great advice. I think people really struggle. And like you said, they feel super shameful and they end up doing nothing. I think that's what we really want. Like, don't do nothing. Don't be so paralyzed by all the information out there. Really find a resource that you can latch onto and then start to explore yourself, your partner, and figure out where you want to start in sort of the toolbox. I'm always thinking about these toolboxes and the toolboxes when it comes to your sexual health, but just do something, like start somewhere. Don't just be like, it's too much, can't deal with this right now, and it's not really a problem, so I'm going to continue to ignore it.
Yeah. I mean, I think the skills you learn in developing a good sex life spill over into the rest of your life. Self-advocacy, communication, being a good listener, trying new things, right? It's like, dude, this is kind of the last bastion of personal growth if you take it as that
Wow.
opportunity.
Yeah. Interesting.
Hallelujah. No, I mean, in episode 2 of this series, where we talk about windows open, is really where we frame kind of what midlife is and what it represents and how to become more intentional about what this new chapter is going to look like. And this idea that it's never too late, And so I really, in the conversations that I've had and for myself personally, like, I'm not giving up on this chapter. I want this chapter. I want to be intentional about intimacy and connection with a partner. And so I think that's why this episode is so important, and all of the episodes in this series are important, is we decide, we have power. We have the ability to make change if change is needed.
You know what part of the problem might be? If you think about it, when we're in our 20s, sex is a goal, right? It's a goal to find the guy or the partner who you may end up with in X amount of time, right? Like, it's kind of like you're on a mission, so to speak. And then you get into your 30s and now sex is still a goal. And the goal is usually to get pregnant. It's not so much about the communication between two partners. And then all those needs go away, right? You kind of are in a relationship or you're not. You kind of don't care if you're not, you're sort of in this ambivalent place, and you certainly don't need to get pregnant now. There's not that urgency. So if you don't think about sex as play, then you're sort of like, this is not important. And I think that's the mindset shift that we have to undo, because I think we're all like, well, sex was a goal and now it's not a goal anymore. It's just kind of like there, but it's an important part of our health in our life.
Yeah, no, I love that. I'm a big fan that as we settle into our 40s and 50s, it is a completely new shift, and one that can be overwhelming, but one that can also be an explosive time for growth in all areas of our life. So God bless that. Okay, so I'm going to ask you a few quick questions, and I would love your thoughts on this. So here we go. Is it true? Do we use it or lose it?
For the practice of sex and the ability to orgasm, yes. For genital urinary syndrome of menopause, no. So if there's a certain amount of muscle, right? Muscle memory could be considered a sport, right? So the more you're good at it, the more, oh yeah, I know what makes me have an orgasm and pleasure. But as far as like, you have to, or you're going to get atrophic, you have to, or you're going to get tight, you have to, or no, absolutely not. There's one study in the 1980s, back when we called it the senile vagina. A gynecology clinic brought in women. They looked at the atrophic women and the non-atrophic women, and the non-atrophic women were having more sex. And that is the use it or lose it paper that people will quote, and they have no idea that this is where the paper came from. And it wasn't a use it or lose it paper. It was a correlation study. Of course, the women with atrophy were having less sex. So nobody's actually done a follow-up use it or lose it paper, but it makes no biological sense that friction on skin is going to change hormones. And it's an awful, awful thing every time I hear that a doctor has told a patient that, or a partner has told a woman that.
Is masturbating helpful? And if so, why?
Yes, tons of data shows that people who masturbate have better sex lives, that they are more easily able to understand what helps them orgasm. You're just more able to get, navigate your body. So especially in the heterosexual couples where the partner doesn't have your body part even, they didn't take a secret class on the clitoris that I'm aware of, right? So it's like relying on somebody else who doesn't even have the equipment to run your equipment doesn't actually make any sense. unless you're teaching them what works for you. And the best way for you to teach somebody what works for you is for you to know what works for you.
Thoughts on dildo versus more of, I'm holding one here, which also happens to be from Women Us, but is more of like a clitoral stimulator. Like thoughts on the differences or benefits of either?
Potato. Whatever people like. I love, personally, the clitoral suction devices, the air pulse ones.
What's that?
Oh, go get one. They're amazing. We have them sponsor the next podcast episode.
Air suction device.
I call them a clitoral air suction device, but they're like wave pulse. They sit on the clitoris. They're very intense. Beginners beware. But they're like the technology. I always joke, like I have 2 vibrators for my mouth, and then people have to think, and I'm like, I have an electric toothbrush, and I have a water pick. A lot of people have vibrators for their mouth. So it's like, it's okay to have, we have technology everywhere.
Yeah.
I have a coffee mug that keeps my coffee warm, right?
Yep.
Like, why are we eschewing technology in this one special little place? Stop making sex exceptional.
Okay. And I love your statement is stop shitting all the time.
Stop shitting.
Stop shitting. Okay. Next one. Thoughts on porn.
Porn. Yeah. Curious what you think.
Porn is fake, people. I just read this study. 80% of men think porn is real. Like, come on, are you that stupid? Like Hollywood is all made up. So is porn. Can be useful for people who do like to get aroused that way. But by and large, we are seeing that it is a poor substitute for sexual education. Yet that is now, especially this day and age, where people are getting their sex education from. And it is leading to a lot of not only just dangerous and aggressive sexual activity, but miseducation and I think harm. We're never going to get rid of porn. It is not going away. Like 1/3 of the internet's bandwidth is legit porn.
Wow. Yeah, but we need to get started. I have an 18-year-old son, and like that's a whole other episode.
Right. You have to talk to him about it.
Oh no,
the parents have to talk to people because it's ubiquitous, and we have to have the narrative because it's not going away.
Oh, it's totally mainstream for them.
But it is fake. And if especially young people, if they don't know from trusted sources that this is not what sex between 2 loving people is, then they're set up for a rude awakening.
And then I'm going to hand off to Taz for the next question. But my last one on this rundown is 3 practical things everyone can do to improve their sex and intimacy.
Lube all the time. Number 1. Number 2, start enjoying your body. Like really like the role of body image and like loving your body and how strong your legs are and how good the lotion feels on your shoulders. Like it's really a body practice, right? Sex is body, mind, and spirit. And so really using because again, stop thinking of sex as like you put the thing in the thing and then you rub the thing and then the thing says, yay, right? Like it's like there's so much more to that. And it's like learning how to love your body is an amazing practice at any age, especially as we age. Like, oh my God, you got me this many years, body. Like, thank you. Okay, so that was 2. And then number 3, learning how to communicate. Just learning how to listen. Ask a question and then just shut up.
It's so funny. Like a lot of these, we're talking about sex, but a lot of these tips and a lot of this conversation goes back to self-advocacy and kind of just being really proud of who you are and where you've landed at this stage rather than sort of looking backwards and being regretful or being fearful or a lot of these emotions that I think people kind of find themselves in when they hit midlife. I think so much of it is just owning it. Like, love yourself. Like you have done God knows how many things if you look back over the last 20 years. And so be proud and own it rather than being so judgmental and critical, which is where I think a lot of people land. I'm too fat, I'm too this, I'm too that. I like, this has happened, that has happened, my boobs hang down to my belly, all this stuff, all this dialogue that's taking place constantly. And I think that chatter sometimes gets in the way, so
like, don't forget the lightness.
Yes.
Like, how did I become this high-powered X, Y, and Z, produce 3 children, and I have no idea how to orgasm? Like, it is silly. Let's learn, right? Like there could be a lightness to it, not a beating yourself up. And, the most beautiful thing, I think, with body image is like, we were not born hating ourselves. We were not born judging ourselves. That was society that got in through our noggin. that we turned on ourselves. And I think just a big self-advocacy is to say, like, no longer will I consent to being negative about myself. Because I wasn't born that way. I'm not going to continue that way.
Well, we have forgotten how to play, and sex, in your words, is play. That's going to stick with me. You have a class. It's the Adult Sex Ed Masterclass. Talk to us about that. Who should be in that class? How does that work? Give us all the deets.
Anybody who didn't get an adult sex ed, which I'm pretty sure is all of us.
Everybody.
Right. Like literally there's no
Yeah.
adult sex ed.
Yeah.
But I'm like, I didn't want to create something that was like, watch out for chlamydia and use I want to talk to people like they understand the basics, because hopefully they do. Right. This is now like, what lubes are out there? What vibrators are out there? How do you communicate? What's responsive versus spontaneous desire, and why does it matter? Right. And like just really kind of taking it to the next level of like, I don't need to rehash the basics for people anymore. I'm assuming you know how to get pregnant or not know how to get pregnant by the time you're coming to my class. My class is like, I think I'm broken because I don't have orgasm from vaginal penetration. And you're like, well, 70% of people don't. You just didn't know that statistic, right? 70% of people do not orgasm by putting something in their vagina. And the 30% who do is because they have some sort of clitoral stimulation via the vaginal walls or externally on the clitoris.
Amazing. And where do we find the class? Just FYI, you don't know this, but I'm signing up.
Kelly Casperson MD.com.
All right, that's my fall back to that's my adult education. For
There
this
we
fall.
go. There we go.
Okay, we're gonna let you go, but nobody is allowed to leave until you can share with us what is your midlife truth.
Yes.
Is it fun? And if it's not fun, why am I doing it?
I'm gonna sit with that. Thank you.
Is it fun?
I want to thank you, Dr. Kelly Casperson MD. Thank you for creating this movement. Thank you for letting me into your life and talking to me at all these crazy conferences when I would come up to you. Thank you for coming to this conversation. And thank you for really helping make this conversation more approachable and normalizing, so much of the nuances of the conversation. Just thank you.
This has been incredible. I think such a resource and incredible for everybody out there.
Congratulations on the new release of the book.
Thank you.
You Are Not Broken, which is the same title of your podcast, which I would highly recommend. All of this information will be in the show notes. So it just got re-released, right? Globally. Is that the case?
Yep. Yeah, it's coming out now. Canada, UK, Australia.
Amazing.
Globally. Yeah, it's cool.
All right.
It's cool.
I can't wait to see you at the event in September. Is there anything you'd like to add? Anything we haven't covered? Anything else you want to shine a light on?
Well, the World Menopause Day is October 18th, and PBS is airing a menopause documentary.
Amazing. That's the M Factor.
That's the M Factor. So that's going to be cool to check out whenever. I don't know when this airs, but
are you in it?
I'm in it. Oh,
yay!
I'm in it. I am the resident sex expert.
That is fantastic. Yeah, it's by Denise Pines, who I've also met at some of these events. So I'm excited to shine a light on her.
They've done this is their third PBS documentary by the directors. They're her third PBS documentary. So she is highly, highly regarded.
Oh, that's great. All right. Well, thank you. You got a long day ahead. Thanks for timing in early your time.
Yes,
you got
I
it.
appreciate it.
You got it.
I'll see you in a few weeks.
Cool. Sounds good.
Take care. Bye-bye.
All right. Bye. Oh my God, was she not amazing?
She was so good. I think I really hope it's helpful for everybody listening, because some of that I even myself haven't heard before, like sex is play. 70% of women don't orgasm with penetration. I didn't know that number. I just thought there were a lot of great pearls that I hope actually make people feel better about what's happening in their bedrooms, for sure.
No, and that's what has attracted me to her as a speaker, as a writer, as a TED Talker. Again, her masterclass, I am going to sign up. I am going to become more intentional about, improving my own sex life. Because again, as she said, you can never be too good. And I think it's an important dimension of our relationships and our own personal happiness. And that's what I love about her, is that you are not broken. We are not broken.
Yeah, we're not broken. And I'm curious if her class is for couples or if it's just for women in particular. We didn't ask her that. But remember, this is a family issue. It's a couple issue, right? It's something that two partners are involved in as they go into this phase of life, which is full of changes, biological changes, pressures. I mean, you're a mom, you're a wife, you know what it's like having teenagers in the home and all of that other stuff. So, I'd be curious, if she deals with kind of like that whole social construct of where we land at this phase of life, because I think that plays into it too.
Totally. As a mom who has a teenage girl who's 16, like I want to be able to, not like physically model for her, but to be able to be communicative and open.
Totally.
And to not have shame or judgment or anything around this topic, but to lead with, being able to talk about these things openly. So I love Kelly for that reason. And the other thing I thought was interesting about her was this whole idea, because I think that we don't focus on it enough, but that our brain is our biggest sexual organ.
It is.
Like what we're thinking, why do we want it? What's important to us? What does it look like? How do I prepare for it in a way that makes me feel good? Like that is it's like the biggest part, right?
It's all mindset. It seems like it's all mindset. And then you're right about our children, because I haven't done that yet, but we have had, at least with my daughter, I've had the conversations of what is healthy sex and what is not healthy sex, because literally the world is at their fingertips. They can pull up any site,
Sure.
No matter what we do in terms of trying to guard them, right? They have access to everything. So helping them understand what's healthy and what's fake and what's, a construct when it comes to sex, I'm thinking it's only going to serve them well as they navigate their next phase.
Yeah, no. And then the other thing I think is it's about ownership, right? Like it is about saying, am I going to be a passenger on this ride? Like so many things, right? About this period of life, right? Like who am I? What's important to me? And what am I going to do to kind of move forward in the right direction? And I'm not saying, I don't think Kelly Casperson is saying that either, that like you have to do this or you should do that or whatever, but it's saying like if this is something that is important to you, then we are breaking the mold now with these podcasts and with these classes and the books available, and even again our sponsor Women S, all of the products that are out there,
right?
And their vernacular on their websites and all of the articles that are on the Women S. Like there's so much information there that is good if we choose to want to lean into it, which I don't feel like it was there 10 years ago.
It wasn't. I'm so glad it's out there now, and hopefully everybody benefits. And you've got to tell us how the class goes once you take it.
I know. I'll report back. Back. Well, thank you for being.
Good
again,
to see you.
Thinking holistically on everything. Yeah, it's great to see you too, and I'll see you in a few short days when we're up again. Okay.
Yes, for sure.
All right. Have a good one.
You too.
Thanks for joining us today, and we can't wait for the next midlife truth called Friendship Matters with life coach, writer, and podcaster Paige Nolan. See you soon.